The first and most common test used to diagnose diabetes is the fasting blood sugar test. This test is often the starting point for anyone who might be at risk, such as people with a family history of diabetes, those who are overweight, or individuals experiencing symptoms like increased thirst, frequent urination, or unexplained fatigue. The fasting blood sugar test is simple, but it's incredibly important because it gives doctors a clear snapshot of how your body manages blood sugar when you haven't eaten for a while. To prepare for this test, you'll need to fast for at least 8 hours, usually overnight. That means no food or drinks, except for water. This fasting period is crucial because it ensures that the results aren't influenced by recent meals or snacks. When you arrive at the clinic or lab in the morning, a healthcare professional will take a small blood sample, usually from your arm or fingertip. The sample is then analyzed to measure the amount of glucose, or sugar, in your blood at that moment. Now let's talk about what the numbers mean. If your fasting blood sugar is below 100 milligrams per deciliter, mg/dl, that's considered normal. If it falls between 100 and 125 mg/dl, you're in the pre-diabetes range, which means your blood sugar is higher than normal but not high enough to be classified as diabetes. This is a warning sign that you're at increased risk, and it's a great opportunity to make lifestyle changes to prevent diabetes from developing. If your fasting blood sugar is 126 mg/dl or higher on 2 separate tests, that's a clear diagnosis of diabetes. The next test you might encounter is the random blood sugar test. Unlike the fasting test, this one can be done at any time of the day, regardless of when you last ate. It's especially useful in situations where someone is experiencing symptoms of high blood sugar, such as extreme thirst, frequent urination, sudden weight loss, or blurry vision, and needs a quick assessment. For the random blood sugar test, a healthcare provider will take a blood sample at any time, regardless of when you last ate. This test is particularly helpful in emergency situations or when symptoms are severe. If your blood sugar level is 200 mg/dl or higher, and you're experiencing classic symptoms of diabetes, that's usually enough for a diagnosis. This test is quick, convenient, and can provide immediate answers, especially if you're feeling unwell. If your random blood sugar is 200 mg/dl or more and you have symptoms like excessive thirst, frequent urination, or unexplained weight loss, it's very likely you have diabetes. Another crucial test in the diagnosis of diabetes is the hemoglobin A1C test, sometimes just called the A1C test. This test is different from the others because it doesn't just measure your blood sugar at a single point in time. Instead, it gives an average of your blood sugar levels over the past 2 to 3 months. This is possible because glucose attaches to hemoglobin, and the A1C test measures the percentage of hemoglobin that has glucose attached to it. The A1C test is especially valuable because it shows how well your blood sugar has been controlled over time, not just on the day of the test. It's often used to diagnose diabetes, but it's also a key tool for monitoring how well someone with diabetes is managing their condition. Here's how to interpret the results. An A1C below 5.7% is considered normal. If your A1C is between 5.7% and 6.4%, you're in the pre-diabetes range. An A1C of 6.5% or higher on 2 separate tests confirms a diagnosis of diabetes. The final test we'll discuss is the oral glucose tolerance test, or OGTT. This test is a bit more involved, but it's one of the most accurate ways to diagnose diabetes. Here's how it works. After fasting overnight, you'll have your blood sugar checked to get a baseline reading. Then, you'll drink a special sugary beverage that contains a precise amount of glucose. After drinking it, you'll wait for 2 hours, during which you shouldn't eat or drink anything else. After the 2 hours are up, your blood sugar is checked again. This test shows how well your body processes sugar over time, and it's especially useful for detecting diabetes in its early stages. If your blood sugar is below 140 mg/dl 2 hours after drinking the glucose solution, that's normal. If it's between 140 and 199 mg/dl, you're in the pre-diabetes range. If it's 200 mg/dl or higher, that's a diagnosis of diabetes. The OGTT is often used for people who have risk factors for diabetes but normal fasting blood sugar, and it's the gold standard for diagnosing gestational diabetes during pregnancy. Remember, early diagnosis means you can start making changes to your diet, exercise and lifestyle to prevent complications and live your healthiest life. If you're unsure which test is right for you, or if you have questions about your risk, talk to us at Halal Medical. Our team can help you choose the best test based on your health history, symptoms, and lifestyle. We're here to support you every step of the way, from diagnosis to ongoing care. Remember, diabetes is manageable, and with the right information and support, you can take control of your health, stay active, eat a balanced diet, and keep up with regular checkups. Thank you for watching this comprehensive guide on diabetes diagnosis. We hope you found it helpful and empowering. Please subscribe, like, and share our channel for more health tips. If you have any questions or concerns, just drop a comment below.